Remote prescribing is becoming increasingly common. In this vlog, we look at the issues and the benefits related to consultations and prescribing online from the patient's perspective, considering how we can ensure safe practice in line with the RPS competency framework. This vlog draws on work which I've been doing, which looks at patient feedback on remote prescribing and remote consultations. It's part of an ongoing action learning project using information from social media and from teaching sessions and workshops. This short vlog focuses on three areas: patients' views of remote prescribing and remote consultations, the different options available for consultations, and patient safety. The aim is to stimulate discussion and reflection around these key topics and possibly dispel some myths. So what are the patients' views about remote prescribing? For many patients, the ability to access services online is something they've been requesting for a long time. Here's an example of somebody who's been asking for remote consultations for many years. In fact, there's been a lot of discussion on social media from patients about the benefits of not having to go to a GP surgery or hospital for appointments. Here's my colleague, Ms. Latif, who I frequently teach with, explaining to students how an online physio consultation works for her. Online access to the rheumatology physio clinic removes the stress of having to prepare, to get dressed up, to drive to the hospital, to pay for the car park and sit around waiting for the consultation. A consultation which may be relatively short. From home, Ms. Latif can actually show the physiotherapist how she carries out daily tasks. She's in a relaxed environment without the stress of the trip to hospital. Here's an interesting conversation from Twitter amongst clinicians looking at the benefits and disadvantages of remote consultations. You may wish to pause for a minute and have a read through the comments. We often hear discussions of how remote consultations are particularly difficult for the elderly. I'd like to throw something else into the mix here and suggest that it's not just the elderly who might be uncomfortable with using technology. This can apply to some younger people too. Also, there's the cost to the patient. For example, if you have no computer or internet access, or you don't have enough data on your phone, this can make online consultations impossible. Additionally, some people are just not comfortable with online consultations. There are the safety considerations too, when you talk to somebody in their own home and you don't know who else is there, which we will cover later in this vlog. Here's an extract from an interesting paper which you'll find in the references section. People who are less suitable for remote consultations are listed as the very old and the very young, and there is a note that the appropriateness of young carers being involved in remote consultations may be problematic. Of course, people who need a physical examination are clearly not suitable for remote consultation. This paper also lists people who are at high risk and with complex needs as potentially unsuitable for remote consultations. Based on my work with patients on some emerging research around substance misuse prescribing in Scotland during the pandemic, I'm not sure this is necessarily true. From my review of the research and from patients' input into the teaching sessions we do, it seems important that different consultation options are given to the patient whenever possible. The idea once mooted of digital by default needs to be replaced by offering options. Specifically, offering options that deliver the safest and most cost-effective outcomes. I'd argue that one sceptical patient who tries an online consultation and finds it beneficial has a bigger effect on take-up of new services than any amount of publicity and promotion from professionals about online consultations. This slide on contacting your GP from the NHS England highlights the different options which are available. Different people would choose different options. For example, some people like the e-consult facility. The benefits of this are that you can take your time and make sure that you've taken the time to write everything you're concerned about. There are prompts on some key disease-related questions, and you can send photographs. In addition, you know that your information will be looked at by a team and the most appropriate person will be chosen to follow up with you. Most GP surgeries in England now have some sort of facility like this. A study in Somerset showed a high level of satisfaction with online access to healthcare. This move to online is part of a wider picture related to the need for full patient access to medical records. Giving patients access to their GP records had a kick-start during the pandemic by the rapid introduction of the NHS app. Again, this is something that many patients have been requesting for years. I believe this initiative represents true modernisation of healthcare. By offering patients access to all their medical records, many problems could be resolved. Patients will be able to check the accuracy of their records and request corrections. It will reduce the delays in finding information, for example, test results. Misplaced or lost notes will become a thing of the past, and different services will be able to see what their colleagues in other areas have done. I also think that online consultations present the perfect opportunity for both ourselves as clinicians and the patient to record the consultations. This will be a huge benefit in terms of patient safety and adherence, in my view. It links to the NICE guidelines on shared decision making and vlog number 1. Finally, in this section, whilst many appointments will require a face-to-face consultations so the patient can be examined, there are an increasing number of approved solutions for self-monitoring at home. Here's just one example. A real-life example is that in cardiology, this allows patients referred to tertiary centres to send their ECGs directly to the hospital team, saving a trip to hospital and facilitating quicker clinical interventions. So here are some questions for reflection. What options do your patients have for their consultations? How do you obtain feedback from patients on the preferred type of consultation? Finally, let's look at the safety aspects of remote consultations and prescribing. There are some specific safeguarding considerations with remote consultations and remote prescribing. Firstly, we need to be absolutely sure that the patient is in a safe place. It's important to be aware of situations, for example, where the person is not free to speak, even if they say they are. Do we know who else is in the property? Who's behind the door? Who's in the other room? Is the patient really alone? Areas of vulnerability include cuckooing, which is sadly quite common, or a partner who's exerting coercive control. Do we have a way to ensure the patient can tell us that they don't feel safe without alerting other people who might be listening in? A safe word or a gesture, for example. Non-verbal clues can be very important here. Also, diversion of medicines may be a problem. That is, people obtaining medication that can be legitimately prescribed for themselves and passing it on or selling it. This is more common than you might think. One of many examples is pregabalin, which is widely available on the streets. When we talk about remote prescribing, there are a wide variety of sources from which people can obtain information on prescribed medicines. There are an increasing number of online pharmacies in the UK. Many of these offer what they call a discreet service, meaning they don't share the prescribing information with the patient's GP. We looked at this in our live online session, and it's picked up in the first prescribing scenario video. There have been deaths related to medicines obtained online, and a recommendation from a coroner in the UK that pharmacies should all be regulated by the CQC. The current situation is that pharmacies are regulated by the GPHC, although the CQC does have a right to inspect if there's a concern. Regulation and inspection, of course, only applies to UK pharmacies. Patients also purchase medicines online from overseas and bring back medicines with them from abroad. Current UK guidance on remote prescribing is listed here. The GMC guidance on remote prescribing, which is repeated in the NMC guidance, lists 10 high-level principles. It's worth your while pausing this vlog here and looking through these principles, which provide a baseline for remote prescribing practice. when we carried out our live session and discussed remote prescribing, one of the students pointed out that we need to be more vigilant. If you remember nothing else, remember this point: we need to be more vigilant. Here are some questions for reflection. How do you ensure you follow the best practice guidance for remote consultations? What issues have you encountered, and how did you manage these areas? I hope you found this vlog helpful. You can find a template for reflection here. It may be that this can be used for your appraisals, peer reviews, and go towards your revalidation. We welcome your feedback. There's a short 3-question survey listed in the links section, which you can fill in as many times as you like. Thank you.